Sometimes a presence is so steady you may not notice it changing. For over 65 years, we've been constantly innovating. And in partnering with Ochsner, we continue to offer the most advanced technology with minimally invasive techniques for general surgery and for specialties from orthopedics to neurosurgery. Many have noticed, earning us the most accolades on the North Shore for quality, safety, and patient experience. St. Tammany Parish Hospital in Ochsner, shaping the future of health.
Hello, and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm Melissa Hodgson, your host, and we're talking today about men's health, prostate cancer diagnosis and awareness, and new technology called UroNav, which helps St. Tammany Health System and local physicians diagnose and treat prostate cancer. We'll talk first with Dr. Joshua Sleeper, a local urologist, then with Dr. Joshua Yellen, a local radiologist, and last we'll talk with Kim Belsom, an ultrasonographer with St. Tammany Health System. So starting with Dr. Sleeper, good morning. Thanks for coming.
Thank you. Thank you for having me.
Very glad to have you here. So UroNav technology aside, as a urologist, can you talk a little bit about men's health and the importance of screenings and coming in annually for diagnosis?
Sure. Well, I mean, worldwide, men have a overall lower life expectancy than women. So urologic health certainly plays a role in that. In the U.S., prostate cancer, after skin cancer, is the most common cancer in men with approximately 190,000 new cases. And the second leading cause of cancer death after lung cancer with approximately 33,000 deaths per year. Screening is kind of controversial, and it's gone back and forth. The U.S. has a preventative task force that makes recommendations from the role of mammograms and annual screenings versus ages and whatnot. And they've gone back and forth with for PSA screening, but now the recommendation is generally to have the patient involved in a discussion about the risks and benefits of screening, and then start screening annually or every 2 years at the age of 55, between the ages of 55 and 69, or earlier if there's a strong family history or in African American men.
Excellent. And so in your practice, you see men on a routine basis, and you're screening according to best practices. And so in the case of someone who maybe has those initial screens come back, can you take us from that point?
Sure. So, we get a lot of referrals from primary care physicians who are doing the screenings for prostate cancer, which is the PSA. And so if a man comes in and the PSA is elevated, and again, that's a long discussion, what is an elevated PSA, but we discuss options, okay? So sometimes we'll repeat the test, and sometimes we feel like a biopsy is indicated, and then we discuss the role of a biopsy and proceed from there.
Okay, and biopsy specifically, certainly that's not a first level, like you're saying. That is, we've seen something, we have some concerns, let's take a look. Right. And so biopsy is an important part of your practice as a urologist. Right. And this UroNav technology makes a little bit of a difference there. So can you talk about the product?
So the standard biopsy involves an ultrasound, a transrectal ultrasound, and we take samplings in standard areas of the prostate. So typically we take 12 cores with a needle using an ultrasound. The vast majority of men who have just an elevated PSA, the ultrasound appears normal. Mm-hmm. We don't see a identifiable region or a tumor to actually hit. And the UroNav involves overlaying an MRI image, essentially giving us a bullseye to hit on the ultrasound image. And there's been studies that have validated that it does improve detection and improves detection of higher grade cancers. And that will certainly play a role in determining treatment options for the patients. There's been a big push over the past decade to actually do what's called active surveillance in men who meet certain criteria, meaning lower risk prostate cancer based on pathology on biopsy, men who have lower PSAs. And this MRI technology is going to certainly allow us to be more comfortable and allow us to reassure men that we're making the right decision for them.
Very good. So what I hear you saying, okay, from primary care, you may see something that gets you referred to Dr. Sleeper, urologist, and then you're going to work with that patient to determine, okay, maybe what we need to do here is a biopsy.
Right.
And then based on that biopsy, you have this ability with the UroNav. Could we, the uninitiated, maybe think of UroNav as a bit of a GPS for you that helps you be sure you're mapping to the place in the patient's body that, in the prostate itself? Help me.
Exactly. You know, when you do a biopsy, it's basically random samplings. Now, we do have standard areas that we target, but you're certainly not hitting the entire prostate. And in a lot of men who have larger prostates, there's no way to sample that area. We see certain lesions in certain areas of the prostate we don't routinely target, and this is what the MRI will allow us to do. My guess is, and there's also been recent recommendations from urologic associations and the radiology associations that men undergo MRIs before standard biopsy. I think that's going to probably be the future.
Okay, so right now we would go from the initial test, you mentioned the PSA, et cetera, and then the biopsy. But you see the future of this process kind of interjecting that MRI before biopsy.
Yeah, certainly.
And so that may be a place that we're going with practice.
True, yep.
Very good. Well, certainly not every hospital has UroNav, and not every urologist has the luxury, if you will, of that opportunity. We're excited to have that here on the North Shore. Can you talk a little bit about your training and how UroNav is different from what you were doing before it was available?
So it still involves the standard ultrasound-guided biopsy that most urologists are familiar with, but we really rely on our radiology colleagues to assist us with this. The MRI technology, like Dr. Yellen will, I'm sure, address, is not a standard X-ray that most physicians can kind of pinpoint and look at and say, I see this spot. It really relies on a lot of technology and the radiologist's expertise to identify the areas in the prostate and then use the technology to overlay it on our ultrasound imaging to allow us to biopsy the suspicious areas.
Excellent. So essentially what this UroNav technology is doing for you, the urologist, is giving you much more certainty and confidence about where that biopsy needs to occur in the prostate.
Exactly. It's a bullseye for us to hit.
Okay. So there's a little less uncertainty about where the biopsy needs to occur. And like you say, a bullseye, we're going to hit the target.
Exactly. You know, a lot of men who will come in for an elevated PSA will do the standard ultrasound biopsy. We don't find any suspicious cancer or suspicious cells. But we continue to monitor them, and their PSA continues to increase, and that causes a lot of anxiety for patients because they say, well, why is this happening? Why is my PSA increasing? And this MRI really gives us a much more confident technique to give those patients answers.
Right, some peace of mind and understanding what's happening in their body.
Right.
Because, correct me if I'm wrong, but with prostate PSA levels, sometimes we can just be in a watch and wait. Yes, the number's rising, but we're not concerned. And so for the individual man who's seeing this number keep increasing, maybe they're sort of like, well, you may not be worried, but I'm worried.
Exactly.
And so this gives a way that we can be much more accurate in the testing.
Exactly. And again, with a big push to do what's called active surveillance, meaning no treatment, no surgery for men who have low-risk prostate cancer, no radiation therapy for men who have low-risk prostate cancer, it really gives not only the patient but the physician great comfort that we're doing the right thing for these men.
Perfect. Well, Dr. Sleeper, thank you so much for coming in to talk with us.
Appreciate your time. Thank you so much.
I'm Melissa Hodgson. This is Healthy Living. And up next, we'll be talking with Dr. Joshua Yellen about the radiology perspective of the new technology, UroNav.
The North Shore. It's our place, where finer things are sometimes the simple ones. Social, sweet, and spirited, but always in harmony. Around here, life is about great things coming together. St. Tammany Parish Hospital and Auctioner, collaborating in the name of community.
Welcome back to Healthy Living. We're talking today about UroNav, technology that helps physicians and St. Tammany Health System to diagnose and treat prostate cancer for men. We talked first with Dr. Joshua Sleeper, local urologist, about the importance of screenings and what patients can expect when they first encounter a PSA test and then the need for a biopsy. We talked about the UroNav system from the urologist perspective, and now next we're going to be looking at it from the standpoint of the radiologist. We have Dr. Joshua Yellen with us today, a local radiologist who works with St. Tammany Health System in the radiology suite. Good morning, we're glad you're here.
Good morning, thanks for having me.
Thanks for coming out. So we are talking today about prostate cancer, and as I mentioned, we talked from the urology perspective in terms of what the patient and the doctor are encountering in the doctor's office, but then once we've done a biopsy, we've got imaging that needs to be read. And so can you talk a little bit from the radiology perspective about where you come into this process?
Absolutely. So in the history of prostate cancer diagnosis, MRI typically played a pretty minor role. In the past, MRI was mainly used once the cancer was bad. And we were trying to figure out how bad it was, had it gone outside the prostate, and was it starting to metastasize. But its utility as a diagnostic tool was actually pretty low. About 7-8 years ago, that started to change. We developed much better technology for imaging the prostate, and we started to figure out that there are other things about prostate cancer we can image other than just the architecture of the lesion that would help us make a determination whether or not this was cancer or not.
Wow.
And so the evolution of that slowly over the past little less than a decade got us to the point that we are at now, where we can produce a study called a multi-parametric MRI of the prostate, multiple parameters. So we not just look at in great detail the architecture of a lesion, but we look at other factors that we know are associated with cancer, and the end result of that is a score that we can then assess each individual spot or question. And that's a pretty accurate way of diagnosing prostate cancer just based on the imaging alone.
That's pretty fascinating. So previous to this use of MRI, you're saying that it really was only once things were bad and we were maybe even thinking it was beyond the prostate that we would even consider an MRI. And this takes it a little earlier in the process.
Absolutely.
So can you talk a little bit about what the UroNav brings to that process?
So the UroNav is the second step in this process.
Okay.
The first part is getting the MRI and getting it done on a piece of equipment that can produce a high quality study, and then of course getting into the hands of a radiologist who has some experience. I think what was alluded to before is that this is really the first time that the urologist and the radiologist work closely together on each individual patient. So it's a two-step process. The first process is get the MRI, and then we can look at each individual lesion, if there is one present, and determine the likelihood of that being cancer. The second step is the UroNav process. We'll take the images, we'll turn it into a three-dimensional model, and then using a computer, I'll be able to identify a questionable cancer, create a three-dimensional model of that, and then send that information over to the urologist. He can then use that and map that onto the ultrasound in real time, and so he can see the MRI and the ultrasound images at the same time when he's going for a prostate biopsy.
Oh, wow. So essentially you're able to get imaging that really gives a three-dimensional real view of what the concerns are, and then you and the urologist together can make those decisions about what you're seeing and what needs to happen.
Yeah, it's pretty astonishing technology. In pretty standardized, and in the past what you would do is you would just use an ultrasound. An ultrasound can show you big aggressive cancers, but it's not very good at showing you smaller cancers or cancer in the earlier stages. And so the way that was dealt with is you would create a template, and urologists would just biopsy a set distance apart from one another and cover the entire prostate. And the assumption was that if we took enough biopsies, we'd get every part of the prostate and we'd find a cancer if it was there. With this advanced type of imaging, while we still do some templated biopsy,
Sure.
you have an idea of where you're targeting. And that makes all the difference in the world, because now you know precisely where you're going to go, and we can grid that down to a matter of a couple of millimeters. And so like you said before, it is very much like a GPS process. It's a targeting system to find a lesion of concern.
Okay. So without the UroNav, we were sort of blanketing the space to a certain extent, figuring full coverage, we'll find it. And what this does is give us more certainty because we're able to really hone in and target. we talked about GPS or bullseye as a way to say that we have more confidence that where we are biopsying is the area of concern.
That's exactly correct.
Okay.
And the other thing too is you think about it, when you're taking biopsies in the prostate, you're limited by how far apart you space those biopsies. And the only way to change that, especially in a big prostate, which as men get older, their prostates get bigger, is to take more biopsies. And so, by the very nature of the process, if you really want to cover the prostate and find smaller lesions, let's say smaller than a centimeter, you have to take a lot of biopsies and cover the whole prostate. Theoretically, this process allows a surgeon to take less biopsies because they know where they're going.
Gotcha.
The other upside to this is that, let's say you do the biopsy and it comes back negative, but the MRI is very strongly positive, and depending on your score, we can be up to 90–95% sure that it's cancer.
Wow.
Well, now you've got a discordant biopsy result. And so we have to go back and say, something's wrong. We need to do another biopsy, or we need to find some other way to reconcile the two different reports. So it not only allows us theoretically to take less biopsies, it allows us to be more precise in targeting and also more accurate in our diagnosis.
Fantastic. So essentially this piece of technology is enabling you as the radiologist and then Dr. Sleeper or his colleagues as a urologist to have much more confidence in the data, to have a sharper picture, if you will, of what's happening there, and therefore to make diagnoses and treatment plans for how we're going to beat that cancer.
Absolutely. If the patient comes in, like you mentioned before, with an elevated PSA, and their prostate is completely clean, I can say with a very high degree of certainty, probably more than 90%, there's no cancer there. So then Dr. Sleeper can be confident in telling his patient, hey, no cancer, we're still going to watch you, active surveillance, but we don't have to worry about this right now, and everybody feels a little bit better. If we see a cancer, and for whatever reason, it's not noted on biopsy, we know we have to continue following this patient very aggressively or do something else. So it not only gives the patients the confidence of knowing they don't have cancer when their MRI is negative, but it allows us to monitor them a lot more closely if there is a questionable finding there, if it's a positive study.
Wow. So thinking about when we spoke with Dr. Sleeper this morning, we were talking about how a patient will see that PSA number, and that PSA number is rising. And as you said, as men age, the prostate enlarges. And so those things are concerning to that patient, and they want to see what's being done and how to protect themselves or how to fight cancer if it's there. And what you're saying is this is giving us even more concrete information that is much more specific and data-driven, and it enables you and the urologist to put that treatment plan together that's much more effective.
Yeah, I mean, for the first time in sort of medical history, we're allowed to look inside the prostate now, which is a very difficult organ to image. At least it has been up until 8 or 9 years ago. So nothing beats being able to see the architecture of the prostate. That is a direct visualization of a potential problem, as opposed to in the past where you just had secondary indications. The PSA is going up, there's a nodule that I feel, I'm having symptoms. Those are all secondary signs. Now we can actually look inside the prostate and say, oh, we see something that's concerning.
Outstanding. Well, visualization of the prostate and of the disease sounds like we've introduced some important technology. Dr. Yellen, I appreciate you coming in to talk with us about the radiology perspective of UroNav.
Appreciate it. Thanks for having me.
Next up on Healthy Living, we'll be talking with Kim Belsom. She's an ultrasonographer with St. Tammany Health System.
Thank you. Thanks. Thank you. Thanks for Sunny Face Eggs for my baby sister.
For my fishing buddy.
Thanks for my mama's gumbo. Thanks for my mom.
We enjoy receiving awards and recognition from our peers, but the true reward comes from seeing positive outcomes for our friends and neighbors. So thank you for trusting us. St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. We're talking today about men's health, prostate cancer diagnosis and treatment, and new technology at St. Tammany Health System called UroNav. We spoke first with Dr. Joshua Sleeper, a local urologist, about the overall idea of men's health and how prostate cancer is a driving factor. Then we spoke with Dr. Joshua Yellen about the perspective of the radiologist in the new technology UroNav. Last, we'll be talking with Kim Belsom, an ultrasonographer with St. Tammany Health System. Good morning, Kim. Thanks for coming.
Thank you for having me.
Really excited to have you here.
I'm excited to be here.
So we've been talking from the medical perspective, what the doctors diagnose, what they see, how they're using this technology. Can you talk a little bit from St. Tammany Health System's perspective, your ultrasound team, and what your background is?
Sure. So we are general and vascular sonographers. And basically what that means is we do everything except for heart ultrasounds, echocardiograms. We'll do, abdomens, thyroids, DVT studies to make sure you don't have a blood clot, babies, of course, baby heads, baby spines. There's just a various amount of ultrasounds that we do at St. Tammany. We also, what I don't think other people realize that we do is we do a lot of procedures and a lot of biopsies with our radiologists. We do paracentesis and thoracentesis, which are draining fluid from the abdomen and the chest cavity. We also do liver biopsies and lymph node biopsies. So we do a lot of procedures also. It's not just scanning, normal ultrasounds. And then, so one of those procedures that we do is the prostate biopsies with the urologist. So our team at St. Tammany, the sonographers, we have some people that are still with us that were students from, we train them and they're still with us. We have some techs that have been there up to 17 years. So there's a lot of level of experience in that department. And we currently, there's 2 of us that have just recently trained in the UroNav. But we do want to train everybody because we feel like everybody needs to know how to do everything at St. Tammany to be able to do all procedures and all exams.
Fantastic. So, we'll talk a little bit about what your training was before UroNav, and then let's talk a little bit about what you did to train for UroNav.
So before UroNav, honestly, the urologist really just needed the ultrasound machine. We were up there to assist them if they needed any sort of adjustments to the machines, to the settings, to get a better quality image. Also just to be there if they had any ultrasound related questions in general. But they're the ones that scan, they're the ones that do all the biopsy part.
So you're the support, but then next.
Right. So now we actually are running the UroNav machine, the computer that does all the, takes the MRI and fuses the ultrasound image. So we'll have the UroNav machine and then we'll have the ultrasound machine right next to it. And so those communicate together. So as the urologist is scanning and looking through the ultrasound machine, we can also see it on the UroNav. So they'll do a sweep of the prostate and it creates a 3D image. And so we take that image on the UroNav that's fused with the ultrasound and the MRI, and we'll make little parameters and kind of line it up with the MRI. So that way when they're scanning and they'll see like the target and the lesion and they can go exactly for that lesion. And so there's this little, it's electromagnetic field generator box. It sits above the patient kind of on a pole. The ultrasound probe has a clip that has a tracking device, and then it has a biopsy needle on the other side of it. So there's a lot going on in the probe, but it's also connected to both the ultrasound machine and the UroNav machine.
Great.
So we do a lot more now than we were before.
That's what I was thinking, that you have the urologist, the radiologist, and the ultrasonographer all have a role to play here. And there's equipment that has been a part of the practice for a very long time, and then this is a new layer of technology.
Yes, ma'am, it is.
Okay. Well, talk a little bit then about the, you were mentioning the 3D modeling. So you have what the ultrasound shows, and then you have what the UroNav is sort of creating from that.
Mm-hmm. So after they have the MRI prostate and Dr. Yellen does his adjustments and does the parameters and outlines where the lesions are, when we go into the operating room, we have to download those images onto the UroNav. And so when we connect the ultrasound machine to the UroNav, we, as the urologist is scanning, we're able to create that 3D image and the biopsies.
And I'm trying to understand what happens once you have that 3D image going, that is in the UroNav, and what is the urologist benefiting from there?
They're able to see the entire prostate from different angles, not just one 2D image like you can in an ultrasound machine. Okay. So basically when they do, the difference from when we used to the regular way of doing prostates and now is that when they do take those biopsies with a needle, we can see the needle go into the lesions, and we can document exactly where every needle goes through. So at the very end, we get another 3D image that has the prostate, the lesions, and then the needles from every single angle. So we look at that at the very end to make sure that we have, that we've gone through the lesions and have a good, accurate biopsy. So
outstanding. So really, your history of the work that you did before UroNav kind of got you ready to be able to see this in a whole different way, and it enables you and the physicians to come away with far more certainty.
Yes.
And data that really suggests that you've found those lesions, you know what you're dealing with, and that is a tool that the physicians then can use for diagnosis and treatment of prostate cancer.
Yes, before with the ultrasound image, sometimes you just don't get a quality image of the prostate. And so before it wasn't really, sometimes you could completely miss the tumor, whereas now when you're looking through the UroNav and it has that target and you're lining up the biopsy needle guide with the target, and that's when they're taking the biopsies, you know that you're getting a good quality specimen because you can see it going through the target that's outlined by Dr. Yellen already on the MRI. And so, it just kind of helps with a more accurate diagnosis and an earlier diagnosis for patients as well.
Fantastic. And obviously early diagnosis is really valuable because the sooner we find it, the easier it is to treat and the more likely it is for full recovery.
Exactly. Right after we first started doing the UroNav, one of the urologists came into the operating room and said that one of his patients, he really didn't think it was going to be as aggressive as the diagnosis came back. And so that completely changed his course of treatment for that patient, which is huge because it really is truly saving lives by getting the diagnosis earlier. So
that's fantastic. I love that story that, obviously the health system has to make decisions about what technology it will and won't buy, and investment in something like UroNav is a big decision. And then to have a physician able to definitively say, look, this made a difference for this patient because we thought we had something this big, and it turned out that it was, this big.
Right, and it also makes me feel very excited and proud to be a part of it because before when we would do prostate biopsies, they really didn't need us. They were just using an ultrasound machine. As sonographers, we don't always get the results because we're just we're just there to assist, so we don't get to see the end of what the results are in the course of treatment and to follow up with those patients. So to hear him say that, it was like, okay, what I did on the UroNav helped him to do his part, which helped to get a good diagnosis and a more accurate and diagnosis for the patient. So.
Well, and that's a wonderful way to show how technology is helping us keep the patient at the center of care and to save and change lives.
Exactly.
Well, Kim, thank you so much for coming in today.
Thank you so much for having me.
This is Melissa Hodgson. You've been watching Healthy Living, brought to you by St. Tammany Health System. We talked today about UroNav, men's health, and prostate cancer. Join us next month for another show on Healthy Living.